Hi friends, first of all, thank you so much for giving me such a lovely and positive feedback. And as per that, today's topic of discussion would be tinnitus. Again, a topic which the people who suffer from tinnitus really are upset about it, and people who don't, the others have not even heard about tinnitus. Now, what is tinnitus? Have you heard about it? Tinnitus is basically a constant ringing, buzzing, whistling, chirping, some kind of noise which is continuously coming in the ear. Now, this can be very annoying when you're trying to concentrate to do some work, or maybe when you're trying to sleep. It has been shown that, especially when you're about to sleep, the patients generally hear the buzzing or the tingling, the tinnitus, much more, and therefore it also causes lack of sleep or difficulty in getting to sleep. This is because you are not being able to think of anything at that time. You are absolutely at idle mind, and therefore that is why it aggravates at that time. Otherwise, generally, medically, the tinnitus is continuous all through the day or waxes and wanes through the day, but it is not related to the night time. Now, why is tinnitus caused? The first thing that we generally say is because of prolonged exposure to the loud music or the loud noise, loud decibels. Now, beware young teenagers and young adults. All of you are so fond of your AirPods and earphones that all of you are listening to your music or seeing your movies at a very loud volume. Beware, later on in life, you can come down with tinnitus. So lower that volume to a medium or a low pitch so that you do not suffer from the consequences. Besides that, people who are working in loud pitched machines with loud pitched machines, or people who've been working with a lot of loud machineries or construction sites, these people also would be the candidates for getting tinnitus at a longer time, at a later time. And it may also occur because of old age. It may occur because of some ear infections or TMJ, that is the temporomandibular joint infection. It may occur because of some lot of earwax inside. It may, age-related, of course, I've discussed. It may occur because of some medicines in Meniere's disease. It can occur when there is an injury to the head or the neck. And these things can be aggravated with alcohol and smoking. Now, what is the pathology behind it? Why is there a buzzing there? Basically, the tiny hair in the inner ear, they get destroyed, and they start sending wrong signals to the brain, which is basically a constant buzzing or a tingling or a constant whistling in the ears. The noise is constantly there. Now, what do you do to avoid it? If it is already there, if you're already suffering from it, then it's best to play a little soft music, or best to, the fan get a regular squeaking voice, something like that, so that it gets less audible and more, comfortable with the other noise. It sort of gets mingled with the outside noise, and therefore it makes you comfortable. Of course, how do we avoid it? How do we stop letting it happen? Is avoid the loud music or the loud decibels exposure. Avoid alcohol and smoking. If it is some kind of medicine that you're having, consult your doctor and see if that is the reason. If there is an infection, get it treated, and avoid alcohol and smoking. And manage your stress. I can never stress more for meditation, 15 minutes in the morning and 15 minutes at night, as I probably speak up in every video. Connect to yourself and all your problems would be solved. So, of course, homeopathy has a very beautiful answer to tinnitus. And another word that I would like to advise is try vitamin B12 or methylcobalamin. That has helped a lot of my patients. So if you have tinnitus, consult a homeopathic doctor and get rid of that buzzing noise. Thank you.